My name is Susan Vollmerhausen. Mabel's been with me about 7 years now. Mabel was presenting some symptoms. You can see she was not in a great deal of pain, but just not as active. She became a little less active. We brought her in because we knew ultimately there was something wrong, just couldn't figure out what it was.
She looks a little bow-legged to me, maybe like her little toes are kind of pointing in a little bit. I highly suspect that she has an injury to her cranial cruciate ligament. Hopefully by giving her sedation, getting some pain management on board, getting her something to help relax her, we can loosen her up a little bit, let me move her legs in a certain way so I can determine for sure if those ligaments are fully ruptured or partially ruptured. So right across here is kind of an extra bulge. That is scar tissue from her knee injury. That's the body trying to restabilize. So this knee is probably an older injury. We'll see how stable it is. No, you see that movement right there? That's called cranial drawer. It should not do that. Her mom and dad thought it was maybe a right leg lameness, maybe a left leg lameness, but they weren't really sure, and it's because it's actually both legs. She doesn't have a real solid joint back here on which to bear weight. So now what we're going to do is take some x-rays, see if we have any other factors that we need to consider in her treatment. There you go. Well, with Mabel, she's right around 7 years old, so she's kind of at that cusp of almost about to jump into senior status, but not quite there. That's a time period where kidney disease can start to show up, liver disease can start to show up, various cancers can start to show up. And so I recommend people that have senior pets come in twice a year because we can help work on this education with each subsequent visit. So what we're looking at here is this is the anatomy of the knee. Hers curve, so they come up here nice and straight and then they go beak and kind of curve across. And so for her, the best return to function, I think surgery would probably be the best course of action. Cost-wise, you're probably looking about $3,500 a leg. Most likely they would want to do one and let her get recovered, get her a good leg, and then go back and do the other one if you feel she still needs to have it done. Hang on, big girl. You ready? Let's go. All right. It was pretty interesting that her mom was seeing it, she just didn't know how to identify it. We can pick up things just from a physical exam that maybe you're just not quite seeing because you see your pet on an everyday basis. Come on. I really believe once she gets through each of her surgeries, you won't even be able to tell that she had a lameness.
I think she'll return to her crazy, ridiculous, running around hyper self. And so I think the diagnosis is good.
Our care and nutrition and preventative care medicine is doing great things. And our pets in the last decade have gone from living 10 years to living 15 to 17 years. It's a wonderful, wonderful thing to see happen.